RGC Podcast.
So, for someone that helps so many people, just knowing that his story is still going to help others, even though he's gone, just, makes my heart full
Yeah.
because I think he would just be so happy to know that he's still helping others.
Hello, Rio Grande City. This is Becky,
And I'm Melinda.
and welcome back to the Lunch Break Podcast with the City of RGC.
Thank you for joining us today. We have,
A few things coming up this week.
yes,
This week and just in general, like coming up. When you want to start off?
sure, the Rio Grande City Chamber of Commerce is having their mixer tomorrow, September 28th at 6 p.m. at the Lopez Tijerina courtyard. And this is a perfect opportunity to meet like-minded entrepreneurs, to network, and to learn more about the chamber. Everybody's invited to attend. The Rio Grande City Public Library is accepting, or they're partnering with the Texas Film Roundup Rio Grande Valley 2023. This program is running now through October 8th, and it invites community members to drop off their home movies at one of 12 locations in Starr, Hidalgo, Cameron, and Willacy counties. Our library is one of those locations. Services are offered in exchange for the donation of a digital copy to the archive program. So this is the initiative from the Entree Film Center, the Texas Archive of the Moving Image, and the Texas Film Commission. They're all collaborating on this project. So you can bring your home movies and you can get them digitized.
And really, it's completely free. The only thing I feel like everybody does need to be aware of, but also don't be scared of it. Like, they archive the actual home movies. So they hold all of them in their archives. But I guess that's quote unquote the payment for it.
Yeah.
Yeah.
But they keep it and they give you a copy.
They give you a copy. But I think it's I'm going to participate because we definitely have some VHSs of when I was a baby.
Oh, really?
Yeah. And I have my grandmother in those, and there's not a lot of video or pictures that we have with her before she passed. So I'm excited to go turn in those VHSs and get a copy. It's going to take anywhere from 6 months to a year to complete the project.
Okay.
So just be aware that it might take a little bit of time. But what else are you doing with those VHSs anyway?
Yeah, just sitting there. I mean, they don't even make players anymore.
No,
So
they're very difficult to find.
I think I found 3 and only 2 of them, or no, 1 of them worked.
Yeah,
So, yeah.
exactly.
The technology is disappearing. So this is an opportunity to get those archived for future generations.
This Saturday at the Basilio Villarreal Municipal Park, Saturday, September 30th from 9 a.m. to 12 p.m., Faro Health Therapeutics is going to be hosting the 2nd annual Alzheimer's Awareness Walk. There's going to be booths and tables of different organizations that offer resources for Alzheimer's, for caregivers of patients with Alzheimer's, and it's going to be a great event. We encourage everybody to go. Mayor Villarreal is going to be there. It's going to be an initiative. It's a Starr County Alzheimer's Awareness Walk, I believe, and they're including everybody from San Isidro to La Gruya to Roma, Rio Grande City, and we just encourage everybody to go out there and just learn a little bit more about Alzheimer's and what Faro Health Therapeutics is doing to combat the disease itself.
Yeah.
So, and that just kind of leads us into who our special guest is for today. Her name is Jessica Cantu. She's a nurse practitioner at Faro Health Therapeutics, and she's going to give us a lot of information, and we're just going to have a really interesting talk with her, so we encourage everybody to stay for the whole thing. It's a very interesting episode today.
Yes, very informative and eye-opening.
Exactly. Today, actually, and it is a little bit late, but I wanted to mention the Kelsey Bass Museum is hosting a fall craft event, and I believe that there's going to be another craft event in the fall, a little bit later on, maybe late October, early November. So I just want to encourage everybody to follow the Kelsey Bass Museum on Facebook. I believe it's City of RGC Kelsey Bass Museum. Follow the City of Rio Grande City Facebook page. That's where we're going to be posting events. They host events, and it's first come, first serve, and you usually do have to sign up and RSVP for them. But they're always a fun event, and I have to say that the museum coordinator, she's just a fabulous, fabulous person, Miss Kathy Rubio, who also happens to be my mother. So it's just a fun time. So again, it's a little bit late for this one. It's happening today.
Yeah.
But definitely keep an eye out for future events because they do always end up being a lot of fun. On October 3rd, it's a Tuesday, next Tuesday, the Rio Grande City Police Department, in collaboration with Rio Grande City Crime Stoppers, is hosting the National Night Out at the Basilio Verial Municipal Park from 6 to 9 p.m. Kids 17 and under are free. They are charging a $1 admission, which it's really more of a donation. It goes towards buying buying gifts for kids for the Toys for Tots.
Yeah.
In Christmas. So we definitely, it's all a good cause. Come on out. We're gonna have different law enforcement agencies out there. There's gonna be Paya Cop, dunking booth, so Dunk a Cop. There's gonna be a tug of war championship between all the different law enforcement agencies. So it's going to be a lot of fun. Come on out. It's again a free event for all kids, and there's just a $1 admission for adults. There's going to be free food, free drinks, little snackies, stuff like that. It's going to be a free carnival. And it's just going to be a lot of fun. So we encourage everybody to come out. Again, it is Tuesday, October 3rd from 6 to 9 p.m. at the Basilio Verial Municipal Park. And the last thing. One more thing. Just want to remind everybody that October 25th is going to be the trunk or treat again at the Basilio Verial Municipal Park from 6 to 9 p.m. as well. It's going to be Wednesday, October 25th, and we encourage all businesses to sign up. You can sign up with me. You can email me at brubio, BRUBIO, at cityofrgc.com, or give me a call at 956-476-9028. Leave me a message or text me in case I don't answer. But if you have a business or organization that would like to sign up to hand out some free goodies to our community, that's how you get a hold of me to do that.
Okay.
I think that's all of our.
That's it.
That's all of our announcements.
All right. Well, then let's start the show.
Let's start the show. Enjoy.
Hello, I'm Melinda.
And I'm Becky. Welcome to the City of Rio Grande City podcast.
Join us every week as we explore the stories, people, and places that make this city so special.
From news and updates, interviews with city officials and administrators, ongoing initiatives,
everyday services and projects our city staff work on in service to our community, we'll bring you the inside scoop on everything Lindo Rio Grande has to offer.
So whether you're a lifelong resident or just passing through, join us for the City of Rio Grande City podcast. Great things continue to happen in Rio Grande City. Hello, Rio Grande City. This is Becky Rubio.
And I'm Melinda Gomez.
And we are joined with a very special guest, Jessica Cantu with Faro Health Therapeutics.
Welcome.
Thank you. Thank you for having me this morning.
Thank you for coming by. We are so excited. So tell us a little bit about what's happening this weekend.
So this weekend, we're having our second annual Alzheimer's Awareness Walk/event here at the Basilio Villarreal Park. We're going to start at 9 a.m. and we'll end around 12. And the reason we do this walk is to bring more awareness about Alzheimer's here in Starr County. We've invited the neighboring cities, Roma, La Grulla, San Isidro. We went to all our community, all of Starr County, to be here and learn a little bit more about what we do at El Faro and how we can talk more about Alzheimer's without it being such a stigma, without being such a taboo subject in our families. And to know that we're available as a resource for any kind of help they need, any questions they may have. I know it's difficult to go through caring for someone with Alzheimer's or dementia, so we want to make sure that we're available to help anyone that needs it.
Excellent.
Awesome.
So what are some of the things that you work on at the El Faro Clinic? Like, what kind of research do you do? I mean, I know it's Alzheimer's, right? But what is, I guess, what's happening? What are you all?
So, an Alzheimer's research center we're the first ones in the valley, right? If you need any other type of interventional research, you would have to go to San Antonio or Houston. So interventional means that there is a study drug that is offered, and then observational means that whatever sponsor, whatever university is doing the study, they're just observing us. So we're about 18 months into being open, and we've done two interventional studies where a study drug was offered. We're doing an observational study right now, and we did another study where it wasn't observational, however, it was interventional because we were intervening in the sense that we drew blood, we were looking for a protein. So we didn't offer study drug with that one. However, it was the very first one we did, and we were able to introduce to the community what it is that we do. The observational one we're doing right now is with Boston University. They've been doing the Framingham Heart Study for 40 years now. They've been studying the heart in Boston, Northeast. So now they're interested in studying Alzheimer's here in Starr County. Why? Because it's been seen that we're number 2 in the nation with the most dementia cases, as per Medicare when they get all those statements, and that's how they know how many cases there are. So because there's so many cases here, they're interested to finding out why. So that observational study going on right now is for anyone ages 18 and up. So it doesn't matter if you have Alzheimer's or not. It's called digital phenotyping. What they're doing, they're going to, after you sign a consent and understand what it's about, you would then do like these games on your phone, on your cell phone.
Okay.
And you're going to be doing the first one is 2 weeks after you sign up, and then every 3 months. So every 3 months is going to be measuring if you're improving or not. So it's a pretty great study, being that where we're at right now, it's 2023. We should be able to try to figure out early on, as opposed to, my grandpa's 75 now, and he's been forgetful for so many years.
Right.
So it's a pretty good study. That's the one we're doing right now. The other studies have closed. However, there's other studies coming soon. So that's all we do is just Alzheimer's research. And we've been trying to educate the community, build a trust there, and explain what is research versus an experiment, right?
Right.
A lot of people think they're just experimenting. So we welcome anyone to go by our office. They can walk through there. They can see. It's pretty homey. Like, it looks like you're walking into someone's home.
It's a beautiful office. I've been there a couple times. Yeah.
Okay. Thank you. And it's not an experiment. Why? Because we're not experimenting on anyone. We're doing research to try to find out, try to help our community. These study drugs that are available, yes, they're being researched. However, that's the only hope we have right now to help others. So that's what we do there.
My grandma and her mom had Alzheimer's, and it runs in the family. So based on the work that y'all have been doing, what would be the most, or what would you recommend, to somebody that has a family history of Alzheimer's, of what they can do to possibly slow it down, or see if they have it, or any venue, possible treatment that is available right now,
There are some genetic testing that can be done, just like the BRCA for breast cancer. There is genetic testing that can be done. However, there's no cure, right, for Alzheimer's.
Right.
And then treatments, but there's treatments that kind of...
There's a treatment that just came out, Leqembi. It came out, Medicare didn't want to cover it. Now they're going to cover so much. However, that's for patients with early onset, right? So for like you and I with a family history, we're younger, we're still in our 40s. What we can do is change our lifestyle. First of all,
Okay.
change our eating habits. We always recommend like a Mediterranean, more fish, more veggies, the olive oil. Try to stay away from so much red meat. And if we are gonna eat red meat, the grass fed,
Okay.
all these chemicals and preservatives in our food, of course, may be at cause. We don't know what it is with us Hispanics that we're 1.5 times more likely to have Alzheimer's than whites, right? So lifestyle, staying socially active. After COVID, we saw a rise in dementia. Why? We were all closed in. We didn't talk to anybody. We didn't really go out. We talked to each other at the house, and
Yeah.
that was
Yeah.
about it. So that's another thing. Staying active, exercising. It's known that just at moving at least 30 minutes a day also helps your memory. Doing things like crossword puzzles, doing things like games on your phone. The study we're doing right now, you're going to be doing a game on your phone, and that will help. Controlling your blood pressure and your diabetes, because there's also the vascular dementia, which diabetes, high blood pressure, high cholesterol affect your arteries, right?
Really? Okay.
Okay.
So there's that. Of course, if you smoke, stop smoking. We call them the 8 pillars. There's 8 pillars that you can try to change now to prevent something like this. And of course, just the most important is keeping, not like pushing it away, not thinking, oh, no, no, I'm okay. Like it wasn't, just keep an open discussion with your physician. If you have questions, you all can call us. But you want to have that open discussion and not push it under the rug and think
Right.
it's okay, it's normal. I'm getting older. And no, forgetfulness is not part of normal aging. I've had patients before, 95-year-old, I'll never forget him, Caucasian man, 95 years old. He was still farming on his tractor every day.
Oh my gosh.
He still brought Bible studies at his church. So his mind was great.
Yeah.
So why, don't think it's normal to
Right.
be so forgetful at the age of 60 or the 70. And then we need to remember that you can see signs, or it can start up to 20 years before.
Really?
And we don't see it until
Yeah,
it's too late.
too late.
Because maybe we're not paying attention to it, right? Maybe
Yeah.
we're just like, oh no, it was just, I forgot this little thing. And little things like forgetting where your keys are at and then finding, that's normal. So there's like a difference of normal aging versus not normal aging. And there's so many resources out there that it's very important to reach out to us. If you can't figure what to do, you can call us and we'll try to direct you whichever way you can go. We've had a lot of patients that I've told, if we can't help you here, I'll help them make appointments in San Antonio and Houston, wherever I know there's a place that can help them. Because
Right.
that's what we want to do, help everyone that needs the help, especially here in the Rio Grande Valley.
When you say that it can, you can start seeing signs as early as 20 years before, like, I guess, full blown Alzheimer's or dementia, what are some signs of that? Like, because, yeah, that happens to me where I'm like, where did I put my keys? Like, oh, or where are my sunglasses? They're right here.
Yeah.
So, what is something that people can look out for?
Yeah, so you just need to, what I meant to say actually was
Okay.
that now they're seeing that, like, let's say I see you when you're 75, right? And then, yeah, you have dementia or Alzheimer's. And then, okay, well, when did you start seeing, oh, when she was about 52, when she retired, we noticed that she started getting depressed. So they're already linking depression with some type of dementia.
Really?
So that's why it's very important to stay social. Because I always tell my patients when they say, oh, I'm so depressed. And I said, I know it's hard because it's hot out here, but the sun is the best antidepressant. We need to go out. We need to get a little sun. The vitamin D in our blood is always low here in Starr County. Why? Because it's so hot here, right?
Yeah,
But we
nobody-
need that sun.
We don't want to go outside right now.
I don't
know.
even want to be outside. I'm
I know, but we need that vitamin D. Why? Vitamin D affects your moods. So that's another thing we need to control. They're also seeing now that a hearing deficit can also cause a dementia. So it's little things like that that we need to fix right now when we're 52, 55, as opposed to waiting and just ignoring it and not wanting to get your hearing tested. And it's a lot of little things that we can do to prevent something that we know as of now there's no cure. And it's very hard as a caregiver to care for your sister, your aunt, your
Right.
grandparent, your father, mother. So more than anything, I'm passionate about this because we went through it with my father, and it was so hard to find resources. So if you were to call me, hey, my tia has this, what can we do? I'm going to try everything I can to try to help you and tell you this is what happened to us. Maybe this can work for you, maybe it won't. But there's a lot of resources out there that can help. And that's why we want this awareness event, because we're going to have a lot of vendors there. You know, the home health agencies are available, provider agencies, Alzheimer's Association will be there. A lot of people will be there to be able to help. And we're there, of course,
Right,
to
of
help
course.
with any questions.
What kind of resources, you mentioned resources, what kind of resources are there for caregivers as far as like not necessarily only medical, but how about like emotional or just information about the disease itself, so that way that helps the caregiver with the patient?
So right now we have a caregiver support group. We started, I think, the end of October last year. And we partnered with We Are Hilarity for Charity, HFC.
Okay.
So Hilarity for Charity is a program that Seth Rogen and his wife made. Seth Rogen's a comedian in Hollywood. His mother-in-law died from Alzheimer's. So they've been open 10 years. If you log into their website, We Are HFC, they have respite, which is like that away time some caregivers need. They have grants, like let's say for our kids in high school and, you know, their grandparents have it. They have like scholarships or grants for them. There's a lot of help there. The Alzheimer's Association webpage as well. They're open 24/7. You can call them 24/7. They have a caregiver support group as well online, and they'll be able to, you know, listen to you. Sometimes you just want to speak to somebody, right?
Yeah.
So the caregiver support group we do here, it's every other Thursday at 4:30. We're having one this Thursday actually. And we have a lady that comes to us. She's a social worker, and she gives like these little pointers or things we can do. So for example, people come in person or log in via Zoom, and it'll be like, oh, Becky, well, how's your mom today? Oh, well, this and this and this happened. So people are sharing their experiences, and just that 1 hour, an hour and a half away, you know, not having that full caregiver responsibility helps a lot. The Area Agency on Aging is another agency here,
Resource.
agency that can also help with respite, things like that. There's a lot of help online that once you log on, you're like it's mind blowing how much help there is out there now.
Right.
So, I mean, we can help guide you, you know, if you need this help or that kind of help.
I think one of the biggest things that people in our area is like you said, don't ignore it. Like, go into the doctor. There's so many people that are like, it's fine, or I don't need to go, or
Yeah.
I can. And that's for everything. Like, not
Yes.
not specific to this, but
Yes.
in every like, oh, it's fine. I'm okay. My grandfather one time, he was on a ladder trying to trim and he was already up in age, like in his 70s, on a ladder trying to trim a palm tree, fell. His arm was completely mangled, and he's like, it's fine. Like, we're like, no, you have to go to the hospital.
Yeah.
Like, so I think that's one of the biggest things that that people do need to be aware. Like,
It's not.
there's nothing to be scared of.
Yeah.
It's scary, I'm sure, but they're like, come in, like, let's try to combat what we have going, like what we can do now. This is what we can help you with, and these are the resources that are out there.
It's okay to not be okay,
It's
right?
okay,
And
yeah.
it's
Exactly.
okay to reach out for help. Another thing we also discuss is the legal documents you'll need, right?
Right.
You need to make sure that power of attorney is in place. You need to make sure the medical power of attorney is in place. Why? Because when it comes down to a diagnosis and they can't sign to give you that power of attorney, you then have to go through legal, right? You
Right.
have to go through an attorney. And so a medical power of attorney and a power of attorney you can do on your own and get it notarized. So it's a lot of little things that we don't think about,
Right.
right? We never think we're going to be in that position, but it's better to be prepared, and it's better to just have as many questions as you can answered. We may not have all the questions for you. However, we are willing to look for answers for you,
Right.
right? And help you out.
That's incredible. And it's incredible. It's happening here in Rio Grande City.
Yes.
Yeah. Um, on just on average, if you have the numbers off the top of your head, how many cases do you see here in Starr County?
So because I'm at the research center, at the sister clinic, Dr. James is there at times. When I was there in 2019, I mean, I would say at least 3 patients every day had some type of dementia.
Wow.
And, it depends. Some days I wouldn't see any. But for the most part, I would say maybe 5 or 7 a week. There was some type of, every 2 weeks, there was some type of dementia going on. And then getting to see a neurologist is difficult.
Yeah.
And then getting a diagnosis is difficult. So it's a long process to getting a diagnosis, and then, okay, what do we do now? What can we do? And we have a lot of information. The National Institute of Health has a lot of information online because we're a clinic or a research center. We're able to get those booklets free. So we have a lot of booklets there at our office that we can hand out to anyone that has any questions, like what to expect, what do I do,
Right.
how can I help. So all of that, it's a tough road, and every patient is going to be different. However, the more prepared we are for it, it'll be helpful if that time comes,
Right.
right?
I have a question. It might be kind of silly at this point to ask, what is the difference between Alzheimer's and dementia?
Oh, sorry about that.
No, that's
so
okay.
dementia is the broad term. Think of an umbrella, right?
Okay.
And this is dementia. Under that umbrella, you would have vascular dementia, Lewy body dementia, frontal temporal dementia, Alzheimer's, which is a type of dementia, and it's the most common one.
Okay.
And even Parkinson's is a type of dementia.
Really?
As
Okay.
well.
I didn't know that.
So there's dementias that can be caused because their vitamins are low, especially in our elderly, and they can be a dementia because they had a urinary tract infection, which is very common. They get very confused, and then their levels go low, things like that. So there's all those, but dementia is the broad term.
Oh,
And then
okay.
they all fall under it. And Alzheimer's is the most common type
The
of
common one.
dementia.
And then the other ones, because Alzheimer's doesn't have a cure, so are the other ones, like you mentioned, the vitamin deficiency, is that
Like
managed with,
if it's something, by the time it gets to that dementia, it's usually hard to reverse it unless
Okay.
it's like a urinary tract infection
Uh-huh.
that they have a little confusion, and then you treat the confusion. It usually gets better. But sometimes that urinary tract infection is already on a demented patient because they can't tell you.
okay.
It hurts
Oh, I
them.
understand.
They
Okay.
can't tell you.
Yeah.
They're feverish. So it's I don't want to say it's reversible. It's just that you can treat some of the symptoms and see if they get better with fluids and
Okay,
things like
okay,
that.
yeah.
but there's no cure like for frontal temporal dementia, which is what Bruce Willis is going
Yeah.
through right now.
Yeah.
There's
that's right.
no cure for it. And sadly, Robin Williams had the same.
Yeah, I had heard that.
Yes,
about
his
that.
his wife put that out recently.
Uh-huh.
So he also went through that. So it's
I
a
didn't know
very
that.
yes.
That's like, this is the first time I'm hearing that. I had no idea.
Yeah.
He was diagnosed that day that he passed.
Oh my goodness.
I read something like that. I'm not sure how true it is.
I
haven't
just
read the
recently heard
book.
that he had been diagnosed with some sort. I don't remember
Yeah, it was
what it was,
frontal
but it
temporal.
was dementia, and then that was perhaps why he.
Yeah.
Yeah.
Yes. So it's a very very sad and scary disease because you don't know what's coming, right?
Right.
So, I mean, more than anything, we can just try to prepare for it. Like I said, it's hard for us to change our eating habits, right? Because we have such great food. We really do. But
Can't complain about that.
I
No.
know, but it may be.
Fajitas?
Yeah. But they see these people in Greece, with
Right.
they live a very long time and they have such great the elderly, their memories intact still, and they have that Mediterranean diet. It's more of a clean eating. We have so many preservatives here
Yeah.
that it's hard to try to change that, but we can try. And eating healthy is expensive. That's another like kind of a turnoff for
Yes.
people
Yes.
because it's so expensive to eat healthy. And when we say fish, of course, we want. I always tell the patients, but make sure it's wild caught. Don't buy farm raised.
Yeah.
Don't buy because
Right.
those are also they're fed, all kinds of preservatives. So you want like a wild caught salmon, a wild caught cod, things like that. That'll help as well. And veggies, a lot of veggies.
Lots of veggies. Yeah. Wow. Thank you so much for coming in. Is there any other questions you have, Melinda?
No. I think that was.
This was really
Yes.
interesting. I mean, I could
Extremely
sit here
interesting.
and you have so much knowledge on it.
Oh, I mean, I every day we learn something,
Right.
I've been a nurse 19 years now, and I've been a nurse practitioner 5 years now, and every day I'm learning something new. My father passed away from Alzheimer's 2 years ago, so knowing, even just 2.5, 3 years ago, I wasn't as knowledgeable, right? And that is why it's just my mission and my passion now to try to help everyone so they don't have to go through what we went through, where
Right.
we felt lost. So, I mean, anything y'all need, if I'm not available, someone can get a hold of me there at the office, and I'll reach back out to anyone that needs to talk to me. Don't exclude them.
Right.
Just because they have this diagnosis, include them in everything. Take them to parties if they're feeling up to it, right? Sometimes the noise is too much. Don't take them out of their comfort zone until the very end, of course. At the very end, they don't like to hear all that noise. They'd rather have like serene, calming music, things like that. But make memories with them every day. Take pictures every day. Like, you won't regret it. You won't
You're right.
regret having those memories and having those conversations with them. They're going to remember the past. So just write all that down. I met a lady in Harlingen maybe in March, and she was writing a book about all the memories. And so that's like, and she told me, you should write a book about your dad. I'm like, I should, because it's so many memories we have with him. And every time I speak about us, I make sure I talk about him, because he worked for Roma, for the city of Roma, for many years. I think it was 30 years. And everyone knew him because he was a supervisor of public utilities, the water, the gas. His name was Tomás Cantu Sr. And he was always helping others. He started the recycling program there in Roma, the Reduce, Reuse, Recycle. He worked with Keep Texas Beautiful with Judith Saffarini. They planted trees, all over Texas.
That's awesome.
He, at the end, when he was already retired, he still kept working. Every day he was doing something. Churches would come down and donate clothes and shoes. He would make sure and call this family or that family and take them, things they needed. Him and my mom would make these little bags with rice and beans and oil and go hand them out to people that couldn't afford it, even going to Mexico, Miguel Alemán, Camargo. So for someone that helps so many people, just knowing that his story is still going to help others, even though he's gone, just, makes my heart full because
Yeah.
I think he would just be so happy to know that he's still helping others even after death, right? So I just always share his story. I usually have his picture on my lab coat, and people right away will recognize him. Oh, wait, what happened? And so there's always
Yeah.
a story to be told. And if our family story can help you or your cousin or your sister, daughter, friend, I'm okay with that. I mean, my family as well, they know that his story is helping others. And we're just excited to be working here and to be able to make a difference. Every day, I never knew I'd be on a podcast talking about
Yeah.
my dad. So, it's really exciting. And we
Yes.
went to Amsterdam to talk about Starr County.
Oh, really?
The Alzheimer's Association International Conference was held in Amsterdam this year. The study we're doing right now with Boston University, they made an abstract. We helped with it. We made a poster about Starr County. There was our picture with Starr County. And I was fortunate enough to go and present the poster.
Wow.
And then I was invited to speak twice at two other different presentations in
Oh,
front
that's
of
awesome.
a room full of other
Incredible.
scientists
Yeah.
about Starr County. So, Starr County's on the map now, and we all these international scientists were heard about us, and we were able to share what we do here. So I feel and I know big things are coming for us here in Starr County.
For sure.
And I think it's great that we're able now to make a difference in our community. And that's what we've always wanted to do.
That is so touching. Like, I teared up a little bit.
I know it gets hard to talk
Yeah.
about my dad and not tear up, but I do it pretty often.
Yeah. No-
and I just have
no
to keep it
shame in that.
together and know that I'm speaking his name, and his legacy lives on every time I speak about him and what he would have still been doing if he could.
Right.
Yeah.
Oh, that's so nice. It's incredible. It's really, like I said, fascinating to hear all of the things that is happening here in Starr County. And it's unfortunate that we're, second in the nation with Alzheimer's cases. But it's also, if you think about it, like that's what's helping us lead the research in it as well.
Yes.
So,
Yes, there's a website for called clinicaltrials.gov, G-O-V. And anytime you have any type of trouble, let's say multiple sclerosis, you can go on there and put, 50 miles from me, and it'll show you all the research done in the United States. So when you type in Alzheimer's, it'll show you what studies are being done, here currently. So if we were to start a new one, I may not be able to tell you personally, but you can then look it up online at that clinicaltrials.gov. It talks about San Antonio, Houston, Round Rock, wherever it is they're doing some here. So that's another way we can find help. If you don't want to reach out to us personally and tell you your story, you can look that up, clinicaltrials.gov, and you can find research studies that can help your family.
thank you so much.
You're welcome. Thank you for
Thank you
having me.
Yeah, thank you for
Thank
coming
you for
by.
coming. We're definitely going to have you again.
Yes.
We're going to try to get Dr. James on here too.
Yes. I already talked to him, and we'll try to get him out one afternoon or something.
Yeah, for sure. We'll work it out, whenever you can.
Okay.
Thank you
Well,
so much for
you.
coming. It was this was a really,
Yeah.
they're all interesting.
Yes.
They're all
yes.
interesting, but this one, like, I definitely, like I said, like, I could talk here forever about this. Like, this is so fascinating and comforting to know that we're working all together towards, the goal. What is the end goal here? Like,
Yeah. I think the end goal is just to be that beacon of light. El Faro is a beacon of light, and we just want to be a beacon of light in the darkness that is Alzheimer's. We want to be that hope for Starr County. We want to be able to help in any way we can. We want to stop Alzheimer's more than anything. So I think we can do it. Like, we've been on national TV shows, we've been on local TV shows, we've been broadcasted in Austin, Houston. And I think, our future broadcast should be about us stopping Alzheimer's some way or another. So that's what that's my goal. And I know Dr. James fully supports us, and he's our principal investigator leading the way. So we're excited about all the future projects we have coming up, and anything new we have, I'll make sure I reach out to you so we can announce it.
Yeah, 100%. Definitely. I'm here for all of it.
Thank you.
So Saturday
There you
at
go.
the Basilio Villarreal Park, September 30th from 9 a.m. to 12 p.m., it is going to be the second annual Alzheimer's Awareness Walk with the Faro Health Therapeutics. And again, we're joined here by Jessica Cantu, who is the nurse practitioner researcher at the Faro Clinic. Thank you for joining us.
Thank you. We can't wait to see everyone there.
It's going to be a great event. Wear purple.
Yes, wear purple. If you're going to go out there on Saturday, wear purple.
Yes. And pray for beautiful weather. I
Yes.
know our Lord will hear us, and we're going to have beautiful weather.
Yes, it's going to be a great day.
Yes. Thank you, ladies, so much.
Thank you.
Thank you.
This podcast is an initiative of the City of Rio Grande City and the Rio Grande City EDC. If you would like to know more about certain topics pertaining to the municipality or have an idea for an upcoming podcast, email mgomez@rgc-tv.com or brubio@cityofrgc.com.
RGC Podcast.